The Blue Cross and Blue Shield Federal Employee Program, or simply FEP, has been committed to providing federal employees and retirees with quality health insurance since 1960. Part of this commitment includes providing comprehensive prescription drug coverage at an affordable price. We also want to make sure you understand your prescription drug costs and what we do to help keep your out-of-pocket costs low for the medications you and your family need. If you've taken a prescription drug for several years, you've probably noticed that the cost has risen over time. You're not alone. According to some experts, prescription drug costs go up 5% a year on average. But sometimes it can even go up by hundreds of dollars at a time. And it's not just for brand name prescription drugs. Many generic drugs, which are usually cheaper, are also seeing price increases each year. But why? And what can you do about it? First, we need to take a look at the prescription drug supply chain to understand how they are priced. You should know that the way prescription drugs are priced is not a simple or straightforward process. In fact, it can be quite complex. That's part of the reason why drugs can be so expensive, but we'll help explain how it works. Different organizations make up the prescription drug supply chain. It starts with the pharmaceutical companies. They make the drugs and set the list price for each one. Then, there are the wholesalers. They transport the drugs and sell them to the pharmacies. The pharmacy is where you get your prescription filled and pay for your portion of the cost. The pharmacy sends a bill to your health plan to pay for the rest. There are also pharmacy benefit managers, or PBMs. A PBM can work for a large corporation, a government agency, or a health plan. Their main role is to negotiate pricing with the drug makers and pharmacies, which helps determine what you'll pay for a drug. Part of their negotiation includes getting rebates from the drug makers to help lower prescription costs. Usually, the PBMs take a portion of the rebate for themselves and pass another piece on to the health plan or their employer. FEP handles rebates differently. We work with our pharmacy benefit manager to maximize member cost savings with rebates. When you fill a prescription at a retail pharmacy, we pass the savings on to you from rebates at the point of sale, which lowers your out-of-pocket costs. Unlike most arrangements, the PBM does not take a portion of the rebate for themselves, and FEP doesn't keep the savings either. All of the savings are passed on to our members. When it comes to your prescription drugs, it pays to have the right information. That's why we created the Prescription Drug Cost Tool. You can see which drugs are covered under your plan, compare the costs for brand name and generic medications, what you'll pay if you use our mail service to have drugs delivered to your home, and more. Try it for yourself at fepblue.org/rxcosts. We believe everyone should have access to safe, effective, and essential prescription medications when they need them, at a price they can afford. That's why Blue Cross and Blue Shield has partnered with nonprofit Civica Rx to help produce more affordable and reliable supplies of generic drugs. Together, we've worked to make generic drugs more available, along with helping consumers like you save hundreds of millions of dollars on their prescription costs. This partnership is just one of the ways we're ensuring that our members' needs always come first. We're also working with other leaders in the healthcare industry to develop even more innovative solutions and programs to make quality healthcare more affordable for all. As your partner in health, we want you to stay aware and informed of your prescription costs. And if you're taking any prescriptions, you can see if your drug is covered under your plan by going to fepblue.org/formulary. We know health insurance can be complicated, but you can always count on FEP to be with you every step of the way.